In this video, I'm going to show how to properly set up the AirICU plus nebulizer from Feellife company. Nowadays, the evidence indicates that the mesh nebulizer technology has a greater efficiency and versatility compared to other ways of aerosol therapy, mainly due to a minimal dead volume or residual volume, and it has a reduced inertial impactation. Today I will demonstrate how to properly set up the device in a PICU environment where we need to perform aerosol therapy during invasive mechanical ventilation in a pediatric patient. Here we have a mechanical ventilator which was set with a double limb heated disposable circuit. First question to solve is where we're gonna settle the T-piece that allow us to put the nebulizer in the circuit. The evidence has shown that we can use in two positions along the circuit. First one is near to the humidification system. Second one is before the Y of the circuit, like this. Like this. And we can add the nebulizer in the T-piece. I prefer and recommend that to use it in this position, near to the humidification system, because in lab studies has proved that in this position has achieved a higher delivery compared to others positioned in the circuit. Second, because it doesn't add an extra weight to the circuit when we use it in the before the Y, because in this thing in the pediatric world it is important not to add too much weight to the circuit near to the patient. In this position we're gonna need a T-piece, and we have to pay attention to set the cap of the nebulizer properly in an upward position, avoiding situations like this or like this. Okay? Then we're gonna use this coaxial cable to connect the nebulizer to the main controller, like this. There you go. And we can also use this support to hold the main controller to the ventilator. Okay? So the AirICU Plus Mesh Nebulizer is equipped with two modes of aerosol therapy. First one is a breath induction nebulization mode that will coordinate the delivery of the aerosol with the inspiration phase of the patient. Second one is a continuous mode that will deliver the aerosol independently of the phase of the respiratory cycle of the patient. When we are using the synchronization mode, the device will run for about 90 minutes and then automatically will stop. Another aspect that we have to take into account is that the sensor flow needs a minimal of 200 milliliters of tidal volumes to run. If your patient is little and you need lower tidal volumes, you can use the continuous mode of the device. To put in the medication in the cap of the nebulizer, we have to open this tab, put the medication in, close this tab, and the cup have a maximal volume of 10 milliliters. Now, here we have our mechanical ventilator with standard parameters in volume control mode, running with a test line. And like I said before, I set a minimal tidal volume of 200. I'm gonna start the device now, pressing the on-off button for 2 seconds, and the synchronization mode will start automatically. As you can see, the lights show us the synchronization with the inspiration phase. And here you can see the aerosol. If I want to switch to the continuous mode, I have to press again the on-off button. The lights indicate that the continuous mode is running, and now you can see the aerosol is continuous. If you're running the continuous mode, the device will run for about 45 minutes and then automatically will stop. An important recommendation is that when our patient is already on invasive mechanical ventilation and we need to start aerosol therapy, we're gonna need to disconnect the patient from the ventilator and connect it to a self-inflating bag to perform manual ventilation, to add the T-piece to the circuit. This part is important because we're gonna need to run a new circuit test to inform the new compressible volume to the ventilator in order to not affect the tidal volume monitoring at the ventilator. If you want to use the device only in the continuous mode, you can use it like this, without the sensor flow. As you can see, the AirICU nebulizer is easy to use and also can be used in other scenarios like non-invasive ventilation or in patients without any ventilation support. In addition, it has a mass median aerodynamic diameter under 5 micrometers, which is in a respirable range, making the AirICU Plus nebulizer a suitable device for critical patients.